Are you using a ketogenic diet as part of ketogenic therapy and wondering how high your ketone level should be? If so, you're not alone. Many individuals are now using ketogenic therapy to treat their psychiatric disorder, type 2 diabetes, PCOS, dementia, or other metabolic condition. And one of the great benefits of a ketogenic diet is that you can actually measure your response by testing your ketone levels. No other diet really allows you to do that. But that presents a question. What should my goal ketone level be? We're going to address the most common circumstances to help you better understand this important issue. Welcome to Metabolic Mind, a nonprofit initiative of Bazooki Group, transforming the study and treatment of mental disorders by exploring the connection between metabolism and brain health. Thank you for joining us on this journey. Now, before we get into the details of specific ketone levels, please remember our channel is for informational purposes only. We're not providing individual or group medical or healthcare advice or establishing a provider-patient relationship. Many of the interventions we discuss can have potentially dangerous effects if done without proper supervision, so consult your healthcare provider before changing your lifestyle or medications. In addition, please recognize people may respond differently to ketosis, and there isn't one recognized universal response. Now, I'm not going to tell you exactly what ketone level you should be at. Instead, I hope to give you a framework to better understand the role of ketone levels and how to work with your healthcare team to find the right level for you. But here's a quick summary, right? Your ketone levels may not matter all that much if your goal is weight loss, as long as you're adhering to your prescribed diet. Now, what about for diabetes remission? It's probably best between 0.5 and 1.5 millimole per liter. For seizures, between 2.5 and 4. And for serious mental illness, probably between 1.5 and 3, or possibly a little bit higher. But let's be honest, that quick summary is an inadequate answer, as the details around these ranges matter. And to be clear, these aren't sort of my definitive recommendations, but rather an attempt to combine recommendations as best I can from the literature and from numerous experts using ketogenic therapy. Now, if you're new to ketosis, please see some of the videos that review what ketosis is and how it affects your brain and what foods you can eat. But in brief, a ketogenic diet is one that's low enough in carbohydrates that your body switches from burning glucose as the primary fuel source to burning fat and in the process creating ketones, which your brain can use as an energy source. And one benefit is that we can measure ketone levels, so we know how much our body is producing. And it's possible that different levels of ketones may provide variable health benefits depending on our health goals. So you can measure ketone levels either in the form of beta-hydroxybutyrate with a finger stick, like Keto Mojo or other brands, or in the form of acetone through a breath meter like Biosensor or others. We usually don't recommend using urine strips to quantitate the level of ketones, but they may be helpful for deciding if someone's in ketosis or not. Now, for the purpose of this discussion, I'll specifically reference blood levels with beta-hydroxybutyrate, since those are the most common and likely the most accurate levels. Now, you may have heard that nutritional ketosis starts at 0.5 millimoles per liter, and that's generally accepted as true, but that doesn't mean that's everyone's goal, right? For weight loss and gradual metabolic improvements, the level may not matter at all. Many studies report weight loss and metabolic improvements with low-carb diets without ketosis, or with ketone levels as low as 0.4 millimoles per liter. Although higher levels generally correlate with better dietary adherence, so that may influence greater success, right? Now, when treating type 2 diabetes, levels over 0.5 are generally recommended, with potentially better results at 1 to 1.5. But it's not clear that levels above 1.5 are more beneficial. For instance, in the studies done by Bret Health demonstrating remission or reversal of type 2 diabetes in up to 60% of participants, rarely did the ketone levels reach above 1.5, and the average was around 0.5. Now, for treating a brain-based disorder like seizures, dementia, or mental illness, it does appear that levels above 1.5 may provide additional benefit. The goal for seizure control in kids is usually 2.5 to 4, and that's reflected in evidence-based guidelines. For mental disorders and psychiatric conditions, we have less evidence than for seizure control, but it appears that between 1.5 and 3 may be a reasonable target. But here's the key. There's likely a high degree of individual variation in how people respond. For instance, let's take Lauren Kennedy of the YouTube channel Living Well with Schizophrenia. She routinely runs in the 3s and 4s, and she actually starts to feel worse if she's below 2. And our own Hannah Warren, she noticed significant benefits initially around 3 or 3.5, And then later on, she had sustained benefits at around 1.5, which she didn't have initially, right? So things can change over time. But then as another example, there's the study by Dr. Shivani Sethi. In her study, the group that had ketone levels above 0.5 only 60% of the time still demonstrated clinical benefits. Now, these benefits weren't as great as those who had levels above 0.5 more than 80% of the time, but they still had remarkable metabolic and psychiatric benefits. And then there's the study by Dr. Ian Campbell out of University of Edinburgh, which suggests levels above 2 correlate with better psychiatric outcomes. And clinical experience from metabolic psychiatry practitioners and other anecdotal reports suggest goal levels around 1.5 to 3, but they all emphasize not getting too caught up on a specific number, but rather being flexible and adjusting the goal based on the individual's progress. So you see there's some degree of flexibility there, but here's another question. How high is too high? Right? Because that's really important for safety. Now, here's as an aside. I was at the American Diabetes Association conference and had a conversation with a prominent endocrinologist who was involved in writing the guidelines that state ketone levels above 3.8 millimoles per liter is by definition ketoacidosis. Ketoacidosis, of course, is the potentially life-threatening condition whereby ketone levels rise and the blood becomes more acidic than is healthy. But I take issue with the definition that any level above 3.8 automatically signifies ketoacidosis because that's defined in a population eating a high-carb diet and having no other reason for detectable ketones. But that's completely different for someone who's eating a ketogenic diet where ketones can routinely go as high as 5 or more in some people. Now, doctors familiar with ketosis may be perfectly comfortable following someone with a ketone level up to 5, but if someone's not experienced, they should proceed with caution and ensure the patient is feeling well and doesn't have evidence of ketoacidosis. But the point is that someone eating a ketogenic diet likely requires different criteria for defining ketoacidosis, especially if they're feeling well. But any elevated ketone level associated with nausea, vomiting, dehydration, mental confusion, signs of acidosis, that needs to be treated as a potential medical emergency. So overall, I hope this discussion about ketone levels was helpful. Again, not to say exactly what ketone levels someone should have, but rather to give a framework for working with the healthcare team to find the target level for each individual based on their goals and lifestyle. If you found this helpful, please like and subscribe, and please leave a comment about what ketone levels work best for you, as we'd love to hear from your experience. Thank you so much for watching. I'm Dr. Bret Scher, and I'll see you here next time at Metabolic Mind, a nonprofit initiative of Bazooki Group.